Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. Just as the world grappled with the withdrawal of the United States from the World Health Organization, key players in the health sector say the subsequent news of the disengagement of USAID is a significant blow to global support in the health sector. This is our focus today on the program. Stay tuned. The conversation begins after this break.
Is the world better prepared for the next pandemic than we were for COVID-19? The answer is yes and no. If the next pandemic arrived today, the world would still face some of the same weaknesses and vulnerabilities that gave COVID-19 a foothold 5 years ago. But the world has also learned many of the painful lessons the pandemic taught us and has taken significant steps to strengthen its defenses against future epidemics and pandemics. Together with the World Bank, WHO established the Pandemic Fund, which is now financing 19 projects in 37 countries with $338 million in grants. WHO has supported many countries to strengthen their lab capacity to detect and sequence pathogens, and we established the WHO Hub for Pandemic and Epidemic Intelligence in Germany to foster collaborative surveillance, to improve local production of vaccines and other medical products. We established the mRNA Technology Transfer Hub in South Africa and a global training hub for biomanufacturing in the Republic of Korea. To improve equitable access to life-saving tools, we established an interim medical countermeasures network. With partners, we established the Global Health Emergency Corps. In May this year, the World Health Assembly adopted a package of amendments to the international health regulations. Our member states continue to negotiate the WHO pandemic agreement. They are committed to finalizing the agreement in time for the World Health Assembly next May. I remain confident that they will.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Folake Kofo-Idowu, an infectious disease and public health specialist. And she is going to share her thoughts on the recent withdrawal by the US from the World Health Organization and this engagement of the USAID in public health support. Good evening, Dr. Kofo-Idowu, and thanks for joining us.
Thank you very much for having me. Lovely to be here again.
All right, Dr. Kofo-Idowu, I know this is no longer a news to you. You've heard the news, and what are your thoughts? Let's start from that. What are your thoughts about the development?
I think the parts that are coming from, or related to the current administrative change in the US are not completely unexpected. It may be to the extent that it is now is what we may not have thought of, but I think there was a bit of anxiety, not knowing what the administration would do, especially they've had previous 4 years that also changed some things with sexual and reproductive health also, and I guess it's just the extent that wasn't known. But as with anything, change is the only constant thing. We just have to prepare ourselves and find a way to move on from it.
Okay, maybe before we go into the impact, let members of the public know how huge the support, the impact from the support from the United States government. You mentioned sexual and reproductive health rights. What are the other projects the country has been supporting other countries with?
I think HIV is one of the biggest diseases that has been receiving foreign aid support, and also for the longest time. PEPFAR now I think has been on for over 20 years. It was instituted during the time of President W. Bush. And so George W. Bush, rather, And so they've been supporting multiple countries, and Nigeria is one of the biggest beneficiaries in West Africa. And in terms of the extent of how much, in 2023, Nigeria received a little above $1 billion, in aid support for different, healthcare packages, and particularly for HIV. So HIV is one, maternal health, child health, adolescent health, sexual and reproductive health is one. Malaria, tuberculosis are also big areas that intervention has been, received foreign aid from.
All right, thank you for that explanation. You also talked about preparation. Nobody knew this would happen, and change is also the only constant thing in life. How do we mitigate the impact? You talked about preparation. We did not prepare. Nobody believed this would happen. Yes.
So like I said, the USAID provided up to 1 billion, a little over 1 billion in aid to Nigeria in 2023. And what we can do, the good-ish thing about it is when the current president of the United States signed the executive order, it was a 90-day halt. It wasn't a total cancellation. But of course, sometimes we know what that means, because when people are receiving life-saving medication, 90 days makes a lot of difference. The good thing is that a waiver has been granted for, life-saving medicines, and that now includes certain medications, including HIV medications, till they can figure out a way to this quagmire. Now, what we can do to mitigate is the government, especially, this is Nigeria we're talking about, probably has to have some kind of emergency plan, because if there's a disruption in provision of HIV care and HIV medications and some other things, then it could be catastrophic for a lot of families, because now people could develop resistance, which means you need more drugs or more expensive medication. So I think the government and the health departments need to have an emergency plan and an emergency fund where they can get the medications and just have a plan to be able to provide the medicines and the support that are needed till they can come up with a more sustainable strategy.
All right. According to a study, every dollar invested in public health generates a return of at least $1 to about $3 in terms of economic benefits. We've been talking about the short-term effects. Let us look at the long-term, short-term effect for donors now, or the key donor, US in this instance. What about the long-term effect for the recipient countries, especially Nigeria?
So the thing about healthcare is, it's interesting because when we pay attention to healthcare only when people are critically ill, especially around here. And that's where public health comes. It really comes in trying to prevent things from happening, usually on a large scale. And what that does is it puts the baseline of the community or the country on a higher stead. That means that we're not easily prone to communicable diseases. We're not easily prone to things that can cause disaster like that. You're talking about cholera. Imagine if there's a cholera outbreak, the number of people that would just die. That's families thrown into disarray, lost wages, lost future wages, the lives of children jeopardized. People are in heartbreak, you've lost life and limb and things like that. So that's what public health does, is the effect sometimes we might not, but health economics will tell you there's a benefit. For every money that is spent, there's actually an economic calculation benefit to determine where the money goes. And it really is trying to keep the population healthy. A healthy population is a productive population. And when your population is working and producing, then, again, the economy increases, earning revenue, and then the stability of families and financial security.
All right. Do you think the agency will be reinstated? Because I don't know if the World Health Organization's withdrawal would also be, reviewed. despite the World Health Organization's appeal and all of that?
I think we shouldn't hold our breath. And the reason I would say that is, first of all, it's not our money, right? So if someone has shown you that they're not particularly enthused about spending their money on you, then you should find alternate means. So I would say let's not hold our breath. And not just because the countries of origin that, certain countries are not funding, but it's also, we also need to take responsibility for ourselves, for our people, for our health. The 2025 proposed budget for healthcare for Nigeria is $33 billion. I am sure that with proper appropriation, we can figure out taking care of our problems. We may not solve everything now, but we can do enough to keep our population on track with $33 billion.
Okay, in this instance, what do you think the federal government should prioritize with this kind of proposed budget in place? As a public health expert now.
I think the government, we'll give them kudos. The federal government and Ministry of Health has been taking significant strides and doing a lot. And, they have this new thing about health fellows. So one is strengthening institutions, building capacity for individuals. We need more health workers, right? And supporting that pipeline. We need more health workers across the entire spectrum, particularly with community level healthcare. A lot of times we focus on the peak, the doctors, the nurses, but who's looking at the communities? Because one doctor, right now, the ratio of a doctor to people in Nigeria is unbelievable. And one doctor can actually not serve the ratio that they actually have. So you need other levels of skilled workers, healthcare workers, to bridge that gap. So investing in human capacity, unfortunately, healthcare is one that it can't just be 3 months short course, like tech, where you learn how to code. It takes time. But the thing is, when you build that capacity, it serves you for a long time, because a lot of people who go into healthcare really do it because they want to help and because they want to serve. And many people find ways to serve their community. So I think supporting healthcare institutions, proper infrastructure, human capacity development, and tending to the welfare, but also looking at our system, our structure, our environment, and developing programs that help. Strengthening primary care, primary, community, and preventive healthcare is very, very important. If we have a good primary care system, it takes care of 90% of the health concerns in the country. So I think with something like that, definitely we will move the needle much faster and much better.
All right, I'm going to take a cue from what you just responded with now. The federal government also just increased the retirement age for doctors to about 65 years. Do you think this is about towing the line? And do you think this is what we need? Is it about extending their retirement age, or bringing in more doctors, ensuring more people stay back instead of, the brain drain syndrome we're experiencing?
Excuse me. So the truth is, for people who are passionate about healthcare, for doctors, I had professors who were working and operating up until their 80s, right? It's weird. Medicine consumes your life. And so many people they can't do anything else, especially people who are generation who are like maybe in their 50s, 60s, 70s, right? They don't know anything else. That was their life. It's my generation now who are maybe 40s, 30s that we're doing all sorts of other things rather, and we're looking for, alternatives to spice up or spruce up our entire 360 life. So for making it 65, I think that's the official thing. But again, is that, are you going to push out? So you're increasing the retirement age, which is fine, but the truth is many already practice. And keep in mind, this limit is probably going to affect those working in public institutions. So a lot of these people, even if they retire from public service, can still go and practice in private service. It's a way to keep them in the workforce, but I can tell you that most doctors who are practicing, if they want to stay in medicine, they stay beyond 65 already. So it's really, that's a short-term solution. The longer-term solution is getting more people in, getting younger people in who can now give you 20, 30, 40 years into the system.
All right, your final words, lessons from these major developments, because the year is just started. We are in February and we are having a lot to, consume and, absorb at the same time. Lessons, what should be the next line of action? The year is still early, right?
Yes. Honestly, I think we should expect the unexpected. We should brace up for whatever it is that could be the worst in a way, and just find a way to take care of ourselves. We need to be responsible for ourselves, and we need to take ourselves more seriously. We are worth more than we think we're worth. We are worth more than we're told we're worth. We have an amazing pool of talent within and outside Nigeria. There's a lot of Nigerian healthcare workers in diaspora, and there's this weird thing about us Nigerians is it doesn't matter where we are, whether you're happy with Nigeria or you're not happy with Nigeria. Nigeria is always on our mouth. We're always talking about Nigeria. We're always looking for how to do something. So I feel like the government just needs to make everything a bit more conducive for people to return. People like me, we've moved back. I have a lot of colleagues who are looking to move back, contribute, build, because one, it is home, it is our people. We want to give back to home and we want to build, and the government just needs to help to create an enabling environment for people to come and build, for people to come and invest and plant roots for trees that will grow into, and build amazing orchards that will benefit the whole country.
All right, this is just a morale booster, and I think we should find time, hope you find time sometime in the future to talk about this brain drain syndrome, what encouraged you to come back, to come and reinvest. Thank you so much. And on that encouraging note, I would like to say thank you so much, Dr. Folake Kofo-Idowu, for your time and expertise on the program.
Thank you.
All right,
Thank you for having me.
It's such a delight to have you on the show. I have been speaking with Dr. Folake Kofo-Idowu, an infectious disease and public health specialist, and she has been sharing her thoughts and expertise on the recent U.S. withdrawal from the World Health Organization, alongside the disengagement of the USAID and other projects to be embraced and prioritized by the federal government. Thank you so much for your time once again. Sound Health continues with trending health report from around the world. Please stay tuned. Where we say thank you on today's episode of Sound Health. I hope your morale has been boosted by Dr. Folake Kofo-Idowu's interview. And we all have what it takes to make Nigeria a better place, be it the health sector, political scene, or whatever sector you're thriving. Make sure you keep being steadfast. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #SoundHealth. A sound health is a sound mind. Make healthy living your choice.